Hello all, Community Coronavirus Update number 66. Today we'll talk about the fact that we're in the red zone, but we haven't scored yet, and then some updates about the Johnson & Johnson vaccine and some other FAQs about the vaccine. So essentially we're in the red zone. We're close to scoring, but we haven't gotten there, and unfortunately people are already celebrating before we've crossed the finish line, or the touchdown line. And we've seen this story before. There are lots of famous cases of both professional and college sports where people almost won the game but didn't because they weren't paying attention right at the end. And I think this is literally where we are right now. We have people basically letting their mask ordinance expires, grabbing or grab groups, throwing off their masks already. This is literally we're so close, but we're about to drop the ball on the first on the 5 yard line. So, if we were herd immunity, which some people seem to think we are, we would still see these numbers dropping. For us to hit herd immunity, this would drop, but what we've had is we've plateaued the last 3 weeks. And what this is basically people were doing the right thing, we're getting things under control, but we've given up prematurely on some of our measures, and so we're hovering here. The question is, will it start going this way or this way? It's a race against time of premature celebration versus vaccination, basically. We don't want to, and we've seen this story in other countries already. So Sweden, everybody thought, oh, they'd done the right thing this summer. That didn't work out over the winter. They finally got things under control with their lockdown. Now they're headed back up again. Same thing with the Manaus, Brazil, and so I highly encourage you to read this article if you really want to understand. They estimated at one point that 76% of the residents did get infected in the initial wave. Back in the spring. Unfortunately, what happened in the last couple months is they had a break recently. It was even worse than this horrible outbreak here. There's a couple theories as to what happened. One is this new P1 lineage variant that there's a few that have escaped to the United States, unfortunately. The other worry is that the community or the coronavirus immunity doesn't last more than 6 to 9 months. And so what you see here is 1, 2, 3, 4, 5, 6 months. Boop, there it goes again. So it may be a combination of the two. It may be a variant plus some waning immunity. Regardless, they did not hit herd immunity the natural way as the Barrington folks thought was possible. We've never hit natural immunity or herd immunity that way in the past. It's only been through vaccination or other public health interventions that we have stopped a pandemic and got R less than 1. So the concept again is to understand is for a pandemic to stop, you have to have R less than 1. Greater than 1 means it's spreading out of control. R1 means it's at a steady state. This is where we are right now. R less than 1 means we get it under control. To do that, you need a couple things in place. And so again, this is what R1 looks like. This is what R1 less than 1 looks like, but now we've unfortunately lost that momentum. So, and the other problem, of course, like I've said before, every new infection is another roll of the dice for a new, more infectious variant. Viruses mutate, that's what they do. So to have R less than 1, we need three things. We need people to wear masks properly. We need them appropriately distanced, not crowd into bars and stores downtown. And we need to get vaccinated as soon as your number is up, and do not be hesitant and pick and choose. So the Johnson & Johnson vaccine is the most exciting new news this past week, as it's already arrived in Nebraska and will start being given to people within days. But people are obsessing about the middle column, and I'd say there's three things to think about, and it's an I-we concept of vaccines. There are two I things, meaning do I get a symptomatic infection? And people are obsessing about this number, but this is the least important of the three. The reason we care about coronavirus so much is because it kills people and puts them in a hospital. On the hospital or death column, the new Johnson & Johnson vaccine is just as effective as the Pfizer Moderna vaccines. Also, these numbers are not comparable to each other because they're studied in different environments with different outcomes with different prevalence of the variants. And so had the Pfizer vaccine been studied here in the same place as the Johnson & Johnson, it might have been the same actually anyway. So don't focus on that. This is the most important number. The second most important number is, does it reduce spread? And it looks like it actually does. So on the CDC call yesterday, the two most important slides on the call, and I've got a link to the full presentation if you want it on the notes section. Number one was the dead not dead slide and the hospitalization slide. So 100% effective apparently against death, preventing death and preventing hospitalization. Yes, some people did get sick. The next most important one was the slide where they talked about asymptomatic seroconversion. That means someone didn't have any symptoms, didn't have a positive test, but they looked like they may have developed an infection, and the vaccine appeared to be 74% protective about reducing that spread. If that pans out, that means the vaccine is almost by itself would stop coronavirus. So essentially, this All vaccines are an I and a we decision. Yes, it does protect you, but also just as importantly, it protects the entire community. Example would be a rubella vaccine in schools. We don't vaccinate school children so much to prevent them from getting rubella. We prevent them from spreading that rubella to their pregnant mothers and teachers, causing birth defects. And so all vaccines are an I and a we decision, and the we is going to be the most important if we want to be normal by summer. So quit focusing on which vaccine you want. Get the one whenever they call your number, and get it as soon as you can get it. So last week we talked about this New York Times. Could we have a supply increase and get to normal by this summer? With this huge increase of Johnson & Johnson vaccines being announced, there's an announcement that they may even have enough for every adult by May. We could literally be toward herd immunity and hitting to pretty much normal daily life again this summer, and wouldn't that be great? But we can't prematurely celebrate. So again, R has to be less than 1. And if that virus presents 3 out of these 4 infections, again, that's what stops the pandemic. So Nebraska is also looking the same. So Lancaster County in Nebraska's rates look almost identical. We have a plateauing here. This is a blip because of a backlog in tests, so that wasn't real. But essentially, we have a plateauing across Nebraska as well. The other concern is that the number of tests being done is also lower, which means we may have more undetected spread because people aren't testing enough either, which is the other part of the strategy people keep forgetting about. The good news here in Lincoln is actually we have sort of our canary in the coal mine, which is University of Nebraska, which is still testing its students pretty effectively. And they publish this on their website dashboard, and so I've linked to that as well. So thanks to UNL for helping protect our community, because our state and our community don't have a very good testing strategy in place, but our university does. And the university students are probably at one of our where we might see the test going spread going up the fastest, and or seeing variants. A lot of them did get infected back in the fall semester, and so this would be their time where their immunity could be waning, just like in Manaus, Brazil. So I will be watching this dashboard every morning actually to see, is this changing, because this one might be our next best way to follow this. So back to the COVID-19 vaccine, there's so much misinformation there. I mean, it's great that on the internet and our smartphones we have access to the entire world's knowledge. We also unfortunately have access to the entire world's conspiracy theories and misinformation as well. So go places that are trustworthy. University of Nebraska does a great job of putting things up there. They list the ingredients. There's all these conspiracy things about what ingredient may or may not be in there, that whatever. Go to someplace reputable, put together by university people. They don't have any financial stake in the game. They just want to make the state healthier and the country healthier. Go here and list. They have a place where you can click on all the ingredients and verify for yourself what is in there. The good news for our vaccines in Nebraska is we're really ramping up. We're now in the top half of states across the country. Our backlog is lower. If you look at the daily average of vaccines versus how much we've got on hand, it's looked like the backlog is down to about 8 days. So it's taking much less time to go from arrival to freezer into an arm, which is great news. The other thing that I'm worried about, you've heard me talk about health disparities in the past. We do have a very big disparity in who is getting the vaccine. So white folks are getting the vaccine, but we haven't gotten to as many of the minority community. Across the board, minorities have a lower vaccination rate than the white folks. So I'm kudos to the health department for putting that data out there, and hopefully we'll start doing that. They are starting to focus on the minority community to try to get them vaccinated as well. They've been hit by this virus harder than everybody else, so we need to make sure that we don't forget them in the rollout. Also, kudos to some of our minority physicians speaking to their communities. There is a big trust issues, and so I listened to Dr. Robert Purcell last night on his call where he talked about some of the mistrust from the African American community. Very much warranted mistrust, but things that have changed since to make sure that this is a very safe and effective vaccine for everybody. Dr. Patera will be talking in Spanish next week to the Hispanic population. So it's good to see this outreach because the study after study shows who do people trust most when it comes to vaccine information. It's their own personal doctor and a local doctor. So thanks for them for putting this out there. Vaccine confidence is improving, and so the surveys are showing that hesitancy is decreasing over time. And as long as we can keep the vaccine resistant and the vaccine hesitant to less than 20% of the population, we will get to herd immunity and we will stop this thing. Some people are worried about, and early on, I think there was some warrant to some mistrust back in November, December. Was it rushed through? I heard an interview of a vaccine expert who says after phase 3 trials where you were talking 30, 40, 60,000 people, he's still worried actually, he said. However, he starts getting less worried when they crossed 3 billion doses. Well, we didn't just cross 3 million. We've literally had over 50 million Americans plus tens of millions across the world get this vaccine. If there were surefire things, we would know it by now. It's very well studied. They're running the numbers. They're publishing them. This is from JAMA a couple of weeks ago, the Journal of American Medical Association, where they did publish what the rates of serious reactions were. The numbers are so small, it's hard to even conceptualize them. So I think it's usually best, again, like past, where you visualize them. So the rates of severe reactions from Pfizer and Moderna, and that's just severe reaction, not death, just severe reaction compared to dying in a car wreck in the United States this past year or dying in coronavirus in the United States this past year. You can see visually there's almost no comparison. So yes, are there some reactions? Yes, there's reactions to everything. I mean, you can get hit walking across the street by a bus, or you get struck by lightning walking home. It's pretty unlikely though, however. So same thing here. Yes, there's reaction, but they're so low compared to here. The vaccine is safe. Go ahead and get it. So finally, at the end of the day, we can keep Nebraska deaths below 3,000 if we don't prematurely celebrate. So wear a mask around anyone who doesn't live in your house. Avoid those crowded confined spaces. Keep your distance and get vaccinated as soon as your number is up. So hopefully this is helpful. Whatever you can do to I would point out to people it is safe to get outside now. We do get together with folks, for example, in the backyard. It's warm enough now with this propane heater. You can still get out. So do that. Don't go inside without your mask. So hopefully this is helpful to you all. This is what I do for my day jobs. However, these are my opinions, not necessarily those of who I work with and for.